Hi students, this is Chapter 5, Breast Anatomy and Physiology. The breast is a well-differentiated apocrine sweat gland of the same type found in the axilla and elsewhere in the body. These glands have evolved into an organ that produces and secretes milk during lactation. When considering what organ of the body breasts belong to, it is the skin organ. So looking at the external landmarks of the breasts, we have four areas that we're most interested in. The axilla, which is the armpit, down to under the breast, which is the inframammary fold, and then the areola complex, which surrounds the nipple, and then the nipple. Those are our basic landmarks. And as we all know, a breast size and shape will vary from person to person, but in most cases, they are going to be mirror images of each other on the same person. So the skin covering the breast is going to be thickest at the base of the breast, which is back adjacent to the chest wall, and then the skin becomes thinner as it approaches the nipple. Sweat glands, sebaceous oil glands, and hair follicles that open to form skin pores occupy the skin of the body and the breast. Sometimes you'll be able to see these in mammograms, especially on women with very fatty breasts. At the breast's most distal point are the areola and the nipple. The nipple is the center point and provides a reference to describe location of normal anatomy and pathology. The areola is a smooth, circular darkening surrounding the nipple. Occasionally, small protrusions on the skin of the areola are visible, especially during pregnancy and lactation. The protrusions are called Montgomery glands. And these glands are specialized sebaceous type, providing lubrication during lactation. So when compressing the breast tissue is going to be thickest, that's adjacent to the chest wall, the base of the breast, and then becomes much thinner as it moves out to the nipple. And so this is the whole purpose of compression, is to make that breast a very homogeneous thickness for imaging. So when we look at the breasts, we're going to break the breast down into quadrants like we do for the abdomen. There's going to be the upper outer quadrant, upper inner quadrant, lower inner quadrant, and lower outer quadrant. Those are for general location of anatomy or pathology. To get more specific, we're going to use the hands of the clock. So, for instance, you could be looking at a lesion or an area of interest in the upper outer quadrant in the 11 o'clock position. So you start by saying which breast are we looking at, which quadrant is the area of interest in, what hour or half hour on the clock are we interested in, and then what is the depth? Is it very anterior, is it central, or is it posterior? The pectoralis muscle is going to run from the humeral head oblique across the chest to the lower sternum. The breast is going to lie anteriorly to this major muscle. And we need to keep in mind that this radiographic landmark is very important, especially with the mediolateral oblique projection. We're going to want to see pectoral muscle on that view. You will find in future lectures and in the book that this is a very important muscle to visualize appropriately when we start doing our screening mammograms. A layer of adipose tissue and connective fascia separates the breast from the pectoral muscle, forming the retromammary fat space. The posterior fascia and the anterior superficial fascia of the skin completely envelop the breast. Internally, the breast includes a varying mixture of fatty tissue and the parenchyma. The parenchyma consists of the following: your glandular components, lymphatic network, blood vessels, connective and supportive stroma. The supportive structure of the breast are called Cooper ligaments. These are fibrous membranes that incompletely sheathe, but they do support the lobes of the breast. Other tissues that give the breast structure support consist of the extralobular and intralobular stroma. The extralobular stroma holds the larger ductal structures, and the intralobular stroma is specialized tissue that gives the lobule its shape and definition. There is an extensive capillary network, allows the exchange of hormones into and secretions out of the lobule, and is in close contact with the lymphatic system. The total amount of glandular tissue decreases and increases with the hormonal changes in the woman's body, and or if there's administration of synthetic hormones. There's also changes if the woman is lactating, is menopausal, and subsequently, with age, this tissue will atrophy. This is where there is the change of a more dense fibrous tissue in the breast to a pure fatty tissue in the breast. If you look at the images here on this slide, the glandular tissue is the white tissue, and the fattier tissue, as you can see more towards the medial aspect of the breast, is the gray fatty tissue. As we mentioned, the breasts are going to be mirror images of each other, and usually one of the breasts may be a little larger than the other, and most often if that happens, it's going to be the left. The breast architecture is the glandular tissue, or the parenchyma as we discussed, consists of 15 to 20 lobes that extend from the nipple in a radial pattern. The ductal flow will follow the radial pattern, forming the normal architecture of the breast. Each of the 15 to 20 lobes contains a tree-like pattern of ductal structures. If you look at figure 510 in your text, and I'm sorry I don't have images on the slides, but I just couldn't get any good images, you're going to see an example of a woman's very fatty breast exam before she started taking synthetic hormones in plate A, and then you look in plate B, some of the glandular tissue that she's developed since starting the hormone therapy. Looking at figure 511, this is showing you the change in a woman's breast. In plate A, the patient is pregnant and is presenting with a 1.5 centimeter lump at the 7 o'clock position. The patient is no longer pregnant in plate B, had a lumpectomy due to a cancer. You can see by looking at this image how that fibrous glandular tissue can cover up a mass in a lady's breast, making it hard to see that mass. So the development of a terminal duct lobular unit is important because this is where the milk is produced. The TDLU is responsible for milk production and hormonal and nutritional exchange. Because this is a very active part of the breast, this is where the breast disease is going to start, whether it is a benign disease or a malignant disease. They're going to arise in the TDLU. Looking at figure 5-12 in your text, you can see the changes that occur in a woman's breast when she goes through menopause. So in figure 5-12, this is before menopause, and she has kind of a 50-50 breast tissue there. 50% is fat, which is the gray area, anterior, and then 50% is glandular tissue, which is the posterior area. And then you look 4 years later in plate B, and you can see that the majority of the breast has been replaced with fatty tissue. Figure 5-13 of your text is showing another change of a significant weight change in a woman. So plate A shows a very fatty tissue in her breast. And this woman had a dramatic weight loss due to anorexia nervosa. But then as she was in recovery from her disease, she put on quite a bit of weight, back to normal, and you can see that her breast looks more what you would expect to see with a heterogeneously dense breast. So as we have seen, there are different ways to classify the breast density. The state of California is one of quite a few states that require that a lady and her physician be informed what kind of breast tissue their breasts are comprised of. And so there is this BI-RADS rating criteria that is used. If the breast is very fatty, it's a BI-RADS A. If it's fibrofatty, meaning it's mostly fatty, but there's glandular tissue too, it's BI-RADS B. If it's fibroglandular, it's BI-RADS C. And this is going to be where there's more glandular tissue than fatty, usually anywhere between 50% to 75% is glandular. And then if you get to BI-RADS D, predominantly the breast is comprised of glandular tissue. It's BI-RADS C and BI-RADS D where a woman is going to be recommended by the radiologist and or by her primary care physician to think about having adjuvant imaging, such as breast ultrasound, MRI, or if she hasn't already, 3D tomosynthesis. And it's simply because what we talked about earlier, the more fibroglandular tissue in the breast, the more white tissue we have that then masks fine calcifications or masses that the radiologist is looking for. So it's wise for women that have very dense breasts to have complementary imaging studies done. So that's the end of this course. Please read the book, do the assignments, and I'll see you at the next chapter. Thank you.